Welcome to Doctors on Call. I'm Jenna Miller. While domesticated pets can be a great source of fun and companionship, they are also complex creatures. Healthcare for humans and pets are not all that different one from the other on some levels. However, animals also have different needs and unique requirements when it comes to their health. For instance, you'll never find a veterinarian who needs to remove a dog or cat's appendix because, in fact, they don't have one. Tonight we'll be discussing what you need to know to assure you give your pet the best life they deserve. Joining us tonight to answer all your pet health questions is our guest veterinarian, Dr. Steve Mosier.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from Gove County Medical Center in Quinter. Healing through caring. Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital, experts, neighbors, friends.
Pet health is our topic this evening on Doctors on Call. Please take this opportunity and call 800-337-4788 with your questions. Dr. Steve Mosier completed his Doctor of Veterinary Medicine at the Kansas State University College of Veterinary Medicine in Manhattan. Dr. Mosier worked in Wichita and Nebraska before joining the Army Veterinary Corps. He then joined Hays Veterinary Hospital in 1970 and became full owner in 1995. Dr. Mosier is a member of the American Veterinary Medical Association and the Kansas Veterinary Medical Association and was named Veterinarian of the Year in Kansas in 2000. Give us a call at 1-800-337-4788 toll-free with your questions about pets on Doctors on Call. Doctors on Call brings you information which may be useful to you when you see your own physician or veterinarian. And we might add that Dr. Mosier is being joined by our special guest dog, mini Labradoodle, Eddie. So Eddie hopefully will hang out with us for the remainder of the show. We'll see how that goes. Thanks so much, Doctor, for joining us. Let's talk about, first of all, sometimes a trip to the vet can be pretty stressful for your pet. What can a owner do to prepare their dog or cat or animal for a trip to the vet?
I think initially to get them used to traveling, number one, if that's the only trip they make, then they're nervous about the trip, not only about where they're going to end up, but about the trip. So I think if you get a pet, take them for short drives, get them used to driving and coming in. And then it doesn't hurt if you're going to come in early, come in and just say hi. I think it's good for those pets to come in and not have anything done. If they get associated, well, I'm going to get a shot every time I come in or something like that. So I think those are two things they can do.
Excellent. That's a great idea. Now, how do you decide whether a vet is going to be a good fit for your family and your pet?
I think only by visiting them, visit the facility and then visit the veterinarian. And all veterinarians have a little bit different philosophy. And so you need to talk to them and see, if you're comfortable with that. And of course, veterinary medicine is changing a lot. There's a lot more technology involved and everything like that. And then you need to decide, what level of care that you're looking for.
Sure. Now, Eddie is, I believe, 3 months old. So let's talk about that, those first shots, those first visits. What can a person with a new pup or cat or animal expect?
Well, the main thing at home is to get them housebroke, and that's a real challenge. But, boy, they're smart if you can do it. And a lot of people are going to bell training now. They go up and have them ring the bell, and the dog knows, I go bring the bell, I'll go outside and go to the bathroom, and that works well.
Sure. Now, let's talk about what are some signs that your pet's behavior might be abnormal?
I think if they're not exuberant, I think people ought to be like dogs. The dog gets up in the morning, he says, it's a new day, and here we go, and most dogs are that way. And if you see they're lethargic or they're not eating and everything, you got to say, well, wait a minute, there's something wrong with their normal routine.
Okay, now let's talk about pet insurance. Is there such a thing, and is it worth it?
There is, and that's a good question. You got to figure out whether it's worth it in western Kansas versus whether it's worth it in suburbia. And there, we take pride in making our prices affordable. And a lot of people think, well, maybe not, but it is. It truly is. If you compare us to Kansas City or somewhere that's affordable, and you got to look at the policy, and you got to see how much you want to cover. They can have one that's just immediate care, or you can have one that covers everything. I question. We don't encourage it too much. We just say it's available to have you look into it and see. And so in western Kansas, I'm still a little dubious that is it worth it. I don't know that it is. And if I had a pet in Kansas City, I think I probably would really look into it strongly. Yeah.
Interesting. Now, is there some vet offices that don't accept pet insurance?
I think most of them will, because they've really designed that pet insurance, the veterinarian does very little. He fills out what he's done, and the owner submits the claim, and so the veterinarian, thankfully, is just kind of on the outside, and so it's not a bad deal or a thing that takes a lot of time as far as the veterinarian's concerned.
Sure. Now, when going back a little bit, we were talking about how do you find a right fit for the vet in your family. What happens? We were kind of talking about this last week with our doctor. What happens if you go into the vet and it doesn't seem like a good fit? What should they do?
Yeah, I think second opinions are becoming more and more the norm. However, if you go in and it just doesn't seem right, I think you just say, well, I'm going to go down and check with it. And most veterinarians we understand that. Sometimes you just don't mesh, and you're not given what they want to see. But yeah, I don't think it's a bad thing.
Okay. What kind of shots? We've got a puppy here with us tonight. What kind of shots are we looking for those young animals in their first year?
Yeah, these young guys, they get a routine series of shots of distemper, hepatitis, and parvo on one hand, and they go through about 3 or 4 of those, 2 or 3 weeks apart, depending on what veterinarian you go to, and then rabies, of course, down the line, and then there's a lot more available. I mean, you can give flu shots. We don't have it in our routine as flu shots, but that's available. But mainly it's the distemper, hepatitis, parvo that we're most concerned about in young puppies. Parvo is really a devastating disease. I mean, it's highly fatal. And so, boy, we like to get them started about 6 to 8 weeks of age and do it every 3 weeks up till they're 16 weeks old.
Okay, what are some of the other risks that might be involved if a person gets an animal and they just don't vaccinate at all?
Well, yeah, parvo, distemper are the two that's the disease-wise, and then of course internal parasites, and they can die from those. They can have too much hookworms or roundworms for something like that. But the worming is probably the main thing, other than the vaccinations. That's what they need to do preventive-wise, and it's really sad. Even now, we see these people come in and they bring them in when they're 4 months old, and they have parvo. And you think, if only they would have given the vaccinations, you wouldn't be there, so.
What's the likelihood that they'll be okay if they were not vaccinated at all?
If they're in a high populated area where they're going to be in contact with a lot of dogs, dog parks, everything like that, I'm all for dog parks, but there is a lot of, you can spread things, then there's a high likelihood that they're going to come down with one of those diseases.
Okay, you mentioned the flu shot. How good do you think those work?
Well, really a good question. We haven't come to the point that we think it's enough of an issue that we put it in our routine. When they first came out with the flu shots, they said, well, anybody that boards dogs or has a congregation of dogs should get the flu shots for their dogs. And then they came out and they had added a second flu shot. So now they've got a combination flu shot, and it's just like in people. They keep adding different things. And so, again, I'm still not a real fan of flu shots. We will give them on request. Mm-hmm. Yeah.
Sure. Excellent. Now, is the flu for the dogs similar to people that it is contagious?
Pretty much, yeah. It can be, and that's the danger of it. But, I've always kind of associated flu with a gastrointestinal problem. But mainly it's a pneumonia type thing that will get them. The pneumonia will get you, yeah.
Sure. So what are if a dog is not vaccinated but gets the flu or pneumonia, what is the treatment?
Well, basically antibiotics and fluids. You know, you get them supportive fluids, and then antibiotics and things for pain. But yeah, that's the basic treatment.
Okay, let's talk about dental health and how important that is for your pet.
Really important. And if you're going to, especially on a little, you know, small dog, if you can train him to let him brush his teeth, well, a lot of people will use a toothbrush and they'll do it. But you got to start young. If you let him get older, it isn't going to work. You know, that dog isn't going to let you do that. And then I think, you know, a lot of people will say you need to be sure and feed dry food, because that helps clean those teeth, I think. And I think there's an element of truth to that. However, there's a lot of them that are raised on soft food or canned food anyhow.
Mm-hmm. And you've got your Eddie's bone with him here. Mm-hmm. How effective are chew bones?
I think they will do some. They won't do everything. Small breeds of dogs are more prone to getting a tartar and dental problems than larger breeds. And I think it's because of what we feed them and then the chew bone type thing.
And are there any kind of bones that you should not give your pet?
You know, we worry a little bit about these rawhide strips. I worry about those a little bit, especially in young dogs. Sometimes they'll chew them, but they then sometimes get them soft enough they swallow them, and then it causes an obstruction in the esophagus or something. So I shy away from that a little bit, even though a lot of people will use rawhide, and I think get away with it, you know, and get along fine. But I'm a little skeptical especially on small dogs, with the little rawhide type things.
And how do you feel about chicken bones?
Well, yeah, that's a no-no, you know. But, you know, it's interesting to me. After many years, you always think about those chicken bones are going to splinter and, you know, penetrate the intestine. Well, that's not so much true. It causes constipation, or it'll cause a buildup from the chicken bones being shattered. So, but we don't recommend them. Sure. Yeah.
Excellent. Okay, we want to remind our viewers that we are talking about pet health tonight with Dr. Steve Mosier and his buddy Eddie. So give us a call if you have any questions regarding your pets at 1-800-337-4788. Let's talk about, we were talking about the flu being passed, you know, between the animals. What about, are there infections that can be passed from humans to animals and vice versa?
Well, I think mainly you're concerned about the vice versa. You know, from the pets, the rabies, of course, is the number one up there. And then they'll talk about leptospirosis being a communicable disease, and then some of the roundworms and some of the parasites that can be transmitted to children that play in a sandbox. So there are some that go that way. I don't know that there's very many that come from the human down. We will see instances where people say, well, the whole family was sick and the dog got sick. Mm-hmm. Well, you have to think that probably it happens, even though they don't talk about it so much.
Sure.
Yeah.
Excellent. Okay, we're going to go to the phone lines now. We've got our first caller, Kristen from Colorado, on the line. Hi, Kristen. Go ahead with your question for Dr. Mosier tonight.
Hi, Daddy. How are you? Hey, my dog is having an issue. Her, Bronny that had the surgery for her cherry eye.
Yes? Go ahead with your question.
Hello?
Yes, go ahead with your question.
Hello? I have a dog that had surgery on her eye for cherry eye. Mm-hmm. It's still a couple times a day, I really have to clean it out. It's really goopy. I'm just wondering if there's something more I can do to help it heal. I'm worried about, it seems like that eye sometimes gets a little cloudy. So I am concerned and wondering what direction I take it from here.
Yeah, I'm sure you probably have been using some antibiotic ointment, cortisone antibiotic ointment. If that isn't working, sometimes we'll say you may need to add some artificial tears. You know, it may be the fact that we're not getting enough tears. And that's one of the things about taking that cherry eye out, is that sometimes they say it is responsible for producing some of the tears that the dog has. So other than that, I would encourage you to get some artificial tears, use that in conjunction with your antibiotic, and then if that's not working, recheck with your veterinarian.
Okay, excellent. We're talking about surgery. What are some of the risks that might be involved in putting your dog under anesthesia?
You know, it's amazing. We've got really good about anesthetic deaths. We have very few anesthetic deaths anymore, and mainly because we've gone to the inhalant anesthetics. And there's more risk, of course, in an older animal. And a lot of times we'll encourage you to do the blood work, the blood panel on older animals especially, before you do any surgery. But in the younger animals, we used to never do any blood work anymore. Some veterinarians won't do surgery without the blood panel, and I understand that. Yeah.
Okay, excellent. Well, Kristen is actually back on the line. She got cut off, so we are going to get Kristen back on the line to finish up her question.
Yep, I'm here.
Yes, go ahead with your question.
Oh, and now I was talking about the cherry eye before, but I do have another question about my other dog. Is that okay?
Absolutely, go for it.
How often do I need to have the anal glands expressed on a French Bulldog?
It will vary from dog to dog and breed to breed. There are some dogs we never express the anal glands. There are some dogs we do it monthly, on a monthly routine basis. And so it depends, and they'll tell you, as you well know, they'll either start scooting or licking that area, and they'll tell you that, hey, my anal glands are full, I need to have them checked.
Okay.
All right.
Love you, Dad. Thank you.
Thank you. So let's talk about blood work. When might blood work be necessary for your pet?
Like I say, there are, the new trend is that you do blood work on everybody prior to doing surgery. We pretty much encourage it, especially in the older animals, because they're a lot more at risk as far as having a problem, kidney-wise or liver-wise or something like that. And it never hurts to have a blood panel. By the same token, you got to say, well, what's the economic cost of that versus what the benefit is? And so, we kind of pick and choose, and there's some that will say, you really ought to do it, and there's some say, probably we can do it without.
Okay, excellent. Let's talk about, again, we're going to go to a puppy question since you've got one in your arms. How can you keep a puppy from chewing on things?
Initially, you're not going to. I mean, it's a nature thing. They're cutting teeth, and they'll cut those new teeth until they're about 8 months old most of the time, and they're going to chew. And so what you do is you give them things that it's okay for them to chew on, not your toe or your shoe or something like that, but they're going to chew. And I don't know, it's just a natural behavior, and they're going to have to go through that stage.
Okay. And food, when you start a new pet out, how do you choose a good quality food for them?
That's a really good question. You go to some of these stores and there's a million different types of food. I think I basically tell people, if you stay with the name brand, middle price foods, you're going to be okay. And so, the ones you recognize, yeah.
And how might you know that your pet has possible food allergies to what you're feeding them?
Really difficult, really difficult. Food allergies comes down, usually we think it's an environmental allergy type thing or a contact allergy thing. And then food allergy in my mind is about 4th or 5th on the list as far as allergies are concerned. And the only way you really know is to stop feeding that, go to a food. And the thing now is they talk about grain-free foods being less allergenic. I'm a little skeptical about how much good it does. I think it does in some cases do some good. So you need to look into that. But and then once you change food, you have to give it at least 6 weeks before you know whether that indeed was a problem.
Sure. Now you see these different commercials that are saying no corn, our food doesn't contain corn or whatnot. Is there any ingredients that you should stay away from?
Well, there again, that's marketing, and so, Purina and some of those, Science Diet, we've fed grain and foods for years and fed it to dogs and gotten along really well. Now they are seeing some gluten allergy type things, and I think there are there, but again, I'm a little skeptical about how important is it, Sure.
Yeah, sure. Let's shift a little bit here. Let's talk about what you do if you suspect maybe abuse when you have an animal brought into your clinic.
Really good question. It becomes a legal issue, and some people are more in tune to that. We try to point out to the owner gently and say, well, we're seeing this, is anything happening here, and try to lead that down the line. I haven't got to the point that I think that it's my responsibility to report it to the authorities. And that's where a lot of people disagree with me, but it's a kind of a can of worms if you start getting into that.
Sure. Now, what would you suggest if, let's say, a neighbor or something sees it at home, that they see a neighbor dog that they suspect is being abused? What kind of advice would you give that person?
Yeah, then I think we always would say, report it to your animal control people and let them visit the person there and say, they have been notified that, maybe this pet wasn't getting as good a care as it should have been. And so we usually try to go through that avenue. Yeah, and I think that's the avenue to report. That's the first way to go. And you can go through the Humane Society, but most of those don't have an investigative type officer, So we usually say animal control if there's one in your area. Mm-hmm. Yeah.
Sure. Okay. Let's talk about the different seasons and what kind of care an animal needs during, whether it's hot weather, cold weather. Let's talk about that.
Well, I think no matter which extreme you go to, they have to have shelter, and they have to have water. And obviously, and especially in the hot weather, sometimes if it gets too hot, they ought to come in. And if it gets too cold, I think they ought to become inside. It becomes what they are used to, and they can be, they can get used to quite a bit. And boy, I see some really nice dog houses. I mean, they're insulated. They've got, maybe I think about moving in sometimes, but really, some of them are really good.
Yeah, with the Tempur-Pedic beds and everything, right?
That's right. That's right.
All right, so let's talk about what a pet owner should do if they are seeing their dog or their cat. We had talked about a little bit earlier about the behavior, some abnormal behavior. If you notice that your dog is sick, do they need to immediately take him to the vet, or can they try to ride it out at home?
I think there's certain instances that they can just kind of ride it out at home. We'll get some calls and say, well, my dog has diarrhea or my dog has vomiting. And a lot of times we'll say, well, cut back on the food, give it a day. And if it continues or gets worse, then obviously it ought to be taken into the veterinarian. But you can do those things. It's just like dogs, they're smarter than we are. Usually if they're sick, they won't eat, But still you cut back on the food and maybe go to a real bland food sometimes if they're vomiting and or diarrhea. But yeah, I think you give it 12 hours maybe. I don't know that it's an immediate thing unless they get into persistent vomiting. If they get into this vomit and vomit and vomit, and still sometimes we'll say, no food, no water. A lot of people think, well, they're going to become dehydrated. I need to give them water. Well, they'll throw that water up just as well as they will the food. Mm-hmm. So, yeah, we usually will say, give them half a day maybe, but if it persists, then it ought to be checked.
And what about emergency services? Do all vets offer that in their clinics?
Most veterinarians will have emergency care or make the allowance for that. Yes.
Sure. Yeah. And when do you know you need to either call or bring them in?
Yeah, you call, and then in our instance you'll get a hold of a veterinarian and you'll talk to them, and then you'll get their feel on that. And it puts the veterinarian kind of behind the 8 ball because you think, okay, here's what we've got. Do I really need to see it tonight? And then and so it's a difficult thing, but you give them your best advice that you can. Yeah.
Sure. And unfortunately, we have we have a lot of farm dogs out there and not that will run out and get hit or whatnot. What should a person do if that happens to their animal?
Those obviously you need to get a hold. You need to take them in and have them checked. Yeah, if they're hit by a car or something like that. Yeah.
Sure. Now, fleas and ticks, let's talk about that. That's coming, that's right around the corner. What can we do, especially for a little guy like Eddie? Can he have the, full dose of what that medicine entitles?
They've got that pretty well tuned in about the size of the dog and everything. And they've come out with so many new flea and tick products, it's unbelievable. And you can use a topical or you can use the pill. And so, yeah, they're there and you need to do it.
Okay, now how common we had talked about infections passed between, dogs and humans. How common are fungal infections in pets?
We see some fungal infections. I don't think it's high on the list, but it's there, Ringworm would be in there, and mainly that's in little kitties. And then the kids will get it, and then it just kind of runs its course. But that would be the first one I would think of. And then there's histoplasmosis, so that's a fungal disease in lungs. And we'll see that in this area. And so, yeah, it's out there.
And you were talking earlier in the show about getting your dog out, before that big trip to the vet. Mm-hmm. How common is motion sickness in dogs?
I think it depends on how much they've been exposed to moving. I think it's there, and we have some people that will use antihistamines, and Benadryl, and sometimes that'll work with motion. But I think it's a matter of training more than anything else. But it's there, and we have people, especially if they're going to take a long trip, they will either use an anti-anxiety medication or they will use some Benadryl or something. And I understand that, you bet.
How effective would be putting the dog in a kennel be inside the vehicle?
I think, yeah, that's probably the safest way to travel. They have anymore. They have safety devices that you can put on them and everything like that. But obviously, I think in the kennel is probably the safest way to go. The thing that scares you a little bit is you see you see these pickups going around and dogs hanging on the outside and looking around. Well, a lot of them get along really well. However, we see enough of them that come in with broken legs or something like that, have fallen out. So we don't encourage that. Yeah.
Absolutely. Well, thanks goes to Dr. Steve Mosier and his buddy Eddie tonight for being on our show. Our next Doctors on Call will be discussing chiropractic care. You can email questions to us for our next program at doctors@shptv.org by Tuesday at noon. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from Gove County Medical Center in Quinter, healing through caring. Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital, experts, neighbors, friends.